Hi, I'm Senator Tom Harkin. I sure regret that I can't be with you in Minneapolis, but I do appreciate this opportunity to thank IMC for honoring me with your Champion of Integrative Health Award. My special greetings to Dr. Gerald Natsky, Dr. Ken Bach, Dr. Richard Linschitz, and Lisa Lundy, also to several Iowans, Dr. Jessica Curcio, Dr. Michelle Clark, and Dr. Joseph Benjamin. I salute all of the attendees, and I thank you for being such passionate advocates for a truly patient-centered healthcare system, one that focuses on treatment outcomes and the inclusion of health and wellness programs that reflect true preventative medicine. I believe strongly that Americans want access to healthcare options and alternatives. That's why I insisted that integrative medicine get a major boost in the new health reform law. Let me briefly mention the key provisions supporting integrative practitioners. First, no health plan or insurer may discriminate against any health provider acting within the scope of that provider's license or certification under applicable state law. This is the first federal provision that will ensure that insurance companies cannot unfairly discriminate against integrative health professionals practicing within the capacity of their training and licensure. Second, with regard to community health teams, licensed complementary and alternative medicine practitioners are specifically included as potential members of these patient-centered, holistic, and interdisciplinary teams. Third, the law establishes a National Healthcare Workforce Commission to examine current and projected needs in the healthcare workforce. The commission specifically includes licensed complementary and alternative medicine providers and integrative health practitioners by defining them as part of the healthcare workforce and by including them in the definition of health professionals. I included these provisions in the Affordable Care Act because this is about giving people choices. It's about improving healthcare outcomes. It's about reducing healthcare costs because integrative healthcare is generally less invasive and less costly. And it's about treating people holistically, not just treating illness after the fact, but keeping people healthy and preventing illness. As we all know, there's a concerted effort to undermine the new health reform law, even to repeal it. Make no mistake, the fight to provide access to quality, affordable health care for all Americans has just begun. As chair of the Appropriations Subcommittee that funds health programs, and as chair of the Health, Education, Labor, and Pensions Committee that drafted the law, I intend to do everything in my power to keep America moving in a progressive direction in terms of wellness, prevention, and access to an integrative care. But I'd be the first to admit to you I can't do it alone. I need you to continue to reach out to your representatives, senators, governors, and state officials. You are the practitioners in the trenches, so you have the ability to tell the most compelling stories about the impact this new law has on the lives of real people. Your stories can emphasize the value of a true healthcare system, as opposed to what we've had in the past, a sick care system. So I want to commend all of you for your participation in this important conference. I appreciate that this is the first time that your four premier integrative health organizations are combining their knowledge and experience in the same meeting. I applaud your collaboration. I thank you for your activism and leadership in the field of integrative health. And again, I thank you for honoring me with this award. So thank you, my friends. Have a great conference in Minneapolis, and by all means, a safe trip home afterward.